Hello, everyone, and thank you for joining us for Eating in Harmony with Nature, Nervous System. Our presenter this evening is Dr. Isha, who has earned her doctorate in naturopathic medicine from the Southwest West College of Naturopathic Medicine in 2022, with a certification in IVIM Basic Fundamentals, Regenerative, and Anti-Aging from the International IV Nutritional Therapy Association. Dr. Isha has a keen interest in medical research and has been involved with microbiology and neuroscience research throughout college and her medical training. Her clinical training was heavily focused on the naturopathic approach to mental health, women's health, digestive health, and chronic conditions. Her goal as a naturopathic physician is to provide well-rounded care for her patients and to educate them along their healthcare journey. Tonight's lecture is being recorded. While participants' audio will be turned off until the end of the program, and at that time, you'll be able to ask Dr. Isha questions. A recording of tonight's program will be available upon request. Dr. Isha.
Great. Thank you so much for that introduction. And welcome everyone to our last installation of Dr. Kaushik's Food as Medicine series. Today's talk will be on the nervous system. So the nervous system has many different disorders, and what we're focusing on is the most common diseases of the nervous system. They're broken up into different types of classifications. One being neurodegenerative diseases, Alzheimer's disease, which is progressive memory loss and cognitive decline, Parkinson's, which is tremors, stiffness, and movement difficulty due to dopamine loss. There are vascular disorders such as strokes, which is disruption in the flow of blood to the brain. Seizures, which is an example is epilepsy caused by normal electrical activity to the brain, and autoimmune diseases such as multiple sclerosis, the immune system attacking its own nerve insulation, causing weakness and coordination issues. The ones that we will be focusing on in this talk today will be the overarching dementia, which includes Alzheimer's, as well as Parkinson's disease. So going a little bit into dementia, about 5% of individuals over the age of 65 and 35 to 50% of individuals over the age of 85 have dementia, and Alzheimer's is the most common form of dementia in our elderly population, accounting for about 60 to 80% of our dementia population. The prevalence of Alzheimer's is also increasing, and by this year, it was expected to reach about 6.7 million people in dementia having Alzheimer's. The clinical presentation is not always just memory loss by the person experiencing this themselves, but usually someone around them, close loved one, which would be classified as informant reporting memory loss is a better indicator, just because the person experiencing the dementia isn't quite realizing that they're having the memory loss, so close family or friends would be able a better indicator that this is what's happening. And there is normal cognitive decline associated with aging, like mild changes in memory, information processing. They usually do not progress and they usually do not affect daily function. With dementia, the decline is a little bit more stated and more outlined. Patients with dementia may have trouble with retaining new information, handling complex tasks, reasoning, spatial ability and orientation, as well as language and behavioral changes. Some risk factors, there are quite a few, age being a big one, genetic factors, previous mild cognitive impairment, motoric cognitive risk syndrome, cardiometabolic risk factors, your lifestyle, your gut health, previous hospitalizations. A big one is previous head trauma, alcohol use, chronic kidney diseases, your homocysteine levels, dietary fat, hearing loss can cause internal ear changes that can lead to changes in the brain. Vitamin D deficiency and organophosphate and organochlorine pesticide exposure. This just being a smaller list. There are quite a few risk factors when it comes to dementia overall. For Alzheimer's, underneath that branch of dementia, There's more of a insidious and gradual onset, characterized by brain deterioration and buildup of proteins known as beta amyloid plaque. Parts of the brain that are commonly affected are the hippocampus, cerebellum, and Alzheimer's can lead to both language and memory impairment. So very often you'll see someone who isn't being able to speak properly the way they used to, or not being able to think of the words that they can right off even after trying their best. There's three stages of Alzheimer's disease: preclinical, mild cognitive impairment, and then Alzheimer's dementia. A little bit of an overview that can be read when you download, but just a little bit into it is when you have mild cognitive impairment, there are some different guidelines that need to be followed when you actually have this diagnosis, opposed to mild cognitive impairment, moderate, and severe. And it's known as a test for MMA. But what you're trying to see is a preservation and ability to function independently versus not being able to function independently. Alzheimer's dementia meets the criteria for dementia, as we mentioned earlier, insidious and gradual onset, but you have to have a clear history of cognitive decline. Depending on the MMA, just one deficit doesn't mean that you have dementia. You would have to have at least more than one of the impairments listed, like impairment in learning and recall, problems with word finding, deficits in spatial cognition. So you're not being able to recognize an object, you're not able to see the word or read them out loud, or impaired reasoning, judgment, and problem solving. And going a little bit into Parkinson's, this is a progressive neurodegenerative disorder primarily causing degeneration of dopaminergic neurons in the substantia nigra, which is a specific part of your brain. And globally, over 10 million people live with Parkinson's and the incidence is upcoming and rising. Symptoms can, as listed, they affect movement, mood, sleep, and autonomic function. You have tremors at rest, muscle rigidity, bradykinesia, so you are having difficulty with your breath, postural instability, constipation issues, and sleep disturbances. Multiple risk factors. A small list of risk factors is your age, genetics with specific genes, environmental toxins, heavy metal toxicity, oxidative stress caused by your environmental toxins as well as diet or other sources of stress, and mitochondrial dysfunction that can be from the cell itself or due to your epigenetics. Going a little bit now into the Ayurvedic part of it, this is something that we're all familiar with at this point. If there's someone new that is present today, welcome. We're talking about our dhatus, so this is specifically how we talk in Ayurveda of different parts of the body. Rasa being the fluid, what makes up your body liquid. Rakta meaning your blood. Mamsa being your tissue. Meda being your fat tissue. Asti is your bone. Majha is your bone marrow. Shukra is the reproductive eggs. And Ojas being your pure essence of your body, your life force. So in Ayurveda, the signs and symptoms of dementia could be understood, but not just as a disease entity, but more as a natural phenomenon. So the brain consists of indriyas, manas, and prana, and your buddhi, which is your ultimate function of the factors that comprise the brain. Buddhi meaning how well you think and how well you process. To put in simplified terms, dementia in Ayurveda is blockages of channels in the body, tissue degeneration, weakening of your ojas, which is the pure essence, weakening of mental function and senses, and a vata imbalance leading to neurological diseases. In the essence relating to vitality, heavy metals and amas can contribute to mental aging. Detoxification is important in this manner because it helps release heavy metals and amas. So, in Ayurveda, detoxification is fighting against aging, decay in the body, as well as disease. the way that ojas and amas can form, the way that amas can form is during biosynthesis of bodily tissues. And all dhatu, so all the different life and body forms that we talked about, the rakta, the tissue, the bone marrow, and the bone, they're all they all have the capacity to create its own ojas, have its own essence. It's present in a single dhatu in our cell, and the collective ojas is the name given to the pure essence of all the dhatus together. So they make one big entity, which is your body, and you have to see how well that is in balance. Detoxifying it, you have to go one dhatu at a time. So deeper and deeper and deeper, being deepest being your bone marrow. And that takes time. Detoxification itself takes time. So in dementia overall, we were talking about detoxifying. Each organ plays a big role. Liver being one of the big ones. Ayurveda links the liver with Agni and Pitta dosha, and as well as Vata. So the Vata is your movement and your circulation. This movement plays a crucial role in making sure that your liver is not blocked. The more your liver is blocked, the more the dementia can play a big role in your life. And it's the liver is also a big detoxification center. It cleanses all your blood. It makes sure your hormones are running balanced. So when we do talk about detoxification in Ayurveda, we talk about Panchkarma. One of the biggest things that we look at is how well can we manage your liver and its detoxification. Another big role for dementia is your gut microbiome. There's been a lot of studies recently talking about how um, the gut and mind connection and the microbiome in your gut leads almost every single process in your body. Your diet can have a profound influence on your brain health, and your GI tract provides you nutrients. So when your gut isn't acting properly, you're not getting nutrients, that means that gut to brain connection isn't working properly and your brain isn't going to be working properly. So the microbiome has a vital role in the health of the GI tract, which has a strong connection with the brain. So reestablishing that gut flora is of utmost importance, whether that's through detoxification, through diet, through probiotics, making sure that what you're eating is affecting your body in a positive manner. So speaking for digestive system, what our Agni is a very big part of dementia. When your Agni is too high, then you get very dried out on the inside. And a lot of what you see with Alzheimer's patients and dementia patients is their brain is somewhat actually shrinking in size because of the rise of that pitta is too drying on the inside, the fire element governing that transformation. So here you can see the factors that weaken the digestive system is poor diet, insomnia, suppression of emotions, vitamin and mineral deficiency, and your lifestyle. Suppression of emotions is a big one when it comes to digestive system. Your emotions settle in specific parts of your body depending on the emotion. For example, the liver can lead a lot of anger and a lot of grief. Kidneys also handle a lot of grief and sadness. Your heart has, the big one, joy, but also, in terms of anger and unresolved issues. So keeping your emotions suppressed manifests into that psychosomatic issues that come up later in life. So making sure to manage the suppression of emotions so you're not keeping them inside, not keeping them bottled because they're only affecting your own body at that point. And then going into overall health management. So identifying and removing the cause, such as heavy metals and other toxins, paying proper attention to your gut health and your detoxification organs, especially your liver, balancing your hormones and ensuring optimal vitamin and mineral levels, ensuring healthy bowel movements, proper diet, nutrition, hydration, and exercise is a big part of healing in this. Circulation throughout your body, circulation to your brain is something that not a lot of people focus on. And the more you're moving your body, the more you're increasing circulation to your brain. And adequate sleep is one of the biggest things you can think of. You do not heal, your body does not start to repair unless you are in REM sleep. What you're doing throughout the day when you take your supplements and when you're putting good nutrients in your body is you're just collecting all of these different factors that will help you repair, and you're just kind of storing them until you are in REM sleep. If you are doing everything right, you're taking your supplements, you're exercising, you're doing all the good nutrition, you're having warm, soupy foods in the winter, you're doing everything right, but you're not getting adequate sleep, then you're not actually using all of these tools that you've given yourself because you're not getting the chance to repair. So cannot stress enough how important good, restful sleep is for your body and your brain. And then now we go a little bit into our diet. What is good for our brain? What is good to detox and making sure that we are keeping our hormones and our brain balanced is leafy greens, non-starchy vegetables and fruits, organic foods, a big one being omega-3 fatty acids in your diet. These healthy fats go straight to your brain and make sure that everything is running smoothly. That can be flax seeds, chia seeds, um, wild caught salmon. Mono unsaturated fatty acids, those would be your almonds, your hazelnuts, your pecans, your pumpkin and sesame seeds, and your olives. Making sure to incorporate polyphenols, so your apples, your almonds, berries, olives, cloves, flax seeds, spinach, and avocados. And adequate water intake. You're not going to be absorbing anything properly if you don't have enough hydration in your gut. Um, the rule of thumb here is taking your weight in pounds, cutting that in half, and drinking that in ounces. For example, if someone weighed 100 pounds, then you would divide that in two, 50. You would need to drink at very minimum 50 ounces of water in order to get the right amount of water. Again, that's the minimum. So going above that is what you should be doing for optimal health, the bare minimum being half of your body weight. But with today's busyness and today's kind of lifestyle, most commonly that I see with patients is, I drank 1 glass of water today, or at maximum 32 ounces, which is one standard water bottle. And just making sure to go slow. If you increase your water intake very quickly, you're not going to be actually absorbing it for the first few times. You're just going to be urinating it out. So add some good electrolytes, some lemon, some pink salt, making sure it's actually being absorbed. And then you can increase your water intake slowly. Start with 10 ounces for 1 week, 20 ounces the next, and then increase to where you need to be. Adequate protein intake and making sure your plate is colorful. All the different colors of the foods that we have in our nature is very specific, whether it be the carotenes and carrots that make it orange. Those are all they play a very specific role in your brain health. So making sure to have all these different colors. Incorporating ginger, turmeric, saffron, garlic. These are all warming foods. So it will make sure that the vata is pacified and in balance, that movement and that air in the body is pacified and in balance. Ghee and fiber. Ghee is very important when it comes to the brain, especially because your brain is a big source of is fat. So it absorbs all of that ghee, all of that fat is going straight to your brain, to your neural pathways. A big reason for anyone who is, you know, had any experience with Brahmi, one of the basic things in Ayurveda is when you give someone Brahmi, which is a very crucial and common herb for any kind of memory cognition, dementia, ADHD, is that you take it with a source of fat, most commonly being ghee, because that's the way it'll go directly to your brain. And then fiber is to get uh, your gut cleaned out, fortifying and working on that mind and gut uh, conversation that they have. Going into high fiber foods, apples, which are a rich source of pectin, a more soluble fiber, the chia seeds, beets, artichokes, barley, green beans, lentils, especially Raspberries pair with the skin and whole grains, meaning 100% of the kernel, like the bran, germ, and endosperm of the whole grain. And then we go into the herbal treatments that we focus on for dementia, Parkinson's, a big one being ashwagandha, brahmiplex, shankpushpi for the brain, guduchi, amalki, macunaplex, withaniaplex, and centella. Nutraceuticals for dementia that are important would be a lot of your B vitamins, thiamine, B12. Zinc is a big cofactor in a lot of your neural pathways, as well as phosphatidylserine and acetylcarnitine. Vitamin C and E are big buzzwords when it comes to brain health and dementia. Vitamin E being a good source of the um, the fat that goes directly to the brain, as well as fish oil. Fish oil also has vitamin E. Anti-inflammatory herbs that we focus a lot on is Triphala, especially for the gut. We really, really focus on that mind and gut connection that we have there. So cleaning out your gut is your first and foremost step when it comes to dementia, Parkinson's, or any kind of nervous system disorder. Guggulu and boswellia to work on the inflammation. Curcumin to also cut down on the oxidative stress and work on the inflammation. And curcumin and saffron to work on warming up the body. And the rest depends on the individual state of health and their symptoms. This is not a exhaustive list, but just more of, the cookie cutter as cookie cutter Ayurveda gets in terms of treatment plans, but how your dosha is and the way that you're presenting to the doctor will determine what else you need to be given, what else you need to take, what else you need to make for lifestyle changes and dietary changes. In terms of treatment, Panchkarma is um, can't be spoken about enough about how useful it is in improving the quality of life. So Panchkarma is the 5 different therapies, Panch being 5, Karma being the therapies or the actions. Abhyanga being our first one, which supports natural blood flow and decreases inflammation in the body. Your skin is your biggest organ. It is the biggest way we detox because of all the pores, but it's also the biggest way that we can absorb. So the way that you take your capsules, it goes into your body, you take 3 or 4 at a time, and that is done there. With Abhyanga, with the medicated oils, you're absorbing up to 15 to 20 times of that medication because the oil itself is medicated and you have a lot of surface area to work with when you go to a Abhyanga and a massage. Shirodhara is the one that we focus a lot on here. The medicated oil to help with the relaxation and strengthen your autonomic nervous system. It works on not even going directly to your brain since you have that tapping motion with that medicated warm oil right here. So all the oil, again, being a fat and your brain absorbing all that fat very easily, it goes straight here, to the direct area it needs to be. But it also works on activating your pineal gland, which is very important in terms of cognition and balancing your body hormones. Swedana is your ozonated sauna. So this promotes healthy circulation and removes any toxins, any amas, like I mentioned earlier. Your skin is your biggest organ. It is the most efficient way to detoxify because you have so many pores on your body. You would just sweat it out when you get to a certain body temperature. And Basti is your herbal medicated enema. You remove toxins and amas in the digestive tract itself, making sure that your digestive tract is clean of any impacted feces, making sure that the entire tract itself is not inflamed, making sure to rehabilitate those villi, those little fingers that you hear about in your digestive tract that get blunted because of titanium dioxide, because of silicon dioxide that are in our foods or in different supplements. So it's very important to see what supplements source you're also getting from, because a lot of store brand options that we have out there now have such additives like silicon dioxide or titanium dioxide, which are very well known for blunting or shortening the little projections that your gut has for absorption. Here you have more surface area for absorption versus when they're blunted, you're not absorbing as well. So Bussy or an herbal enema is very useful and important in making sure that that bluntness is going back to where it should be. Different lifestyle changes. Continued is deep breathing, calming the autonomic nervous system, yoga, which increases circulation, works on your vata, and decreases inflammation, meditation, avoiding pesticides and other environmental toxins. So this is a very broad statement, right? Avoiding pesticides would be making sure you eat organic, but supporting your local farmers. They will let you know what is actually organic versus different labels such as Whole Foods, because it's a very tricky word, as you might have seen in your own experiences of what actually is organic or what's not. So making sure to shop locally as much as you can with your farmers. And environmental toxins, we have pollutants everywhere in the world. Heavy metals are so common, and they settle deep inside of your tissue and your fat tissue and your brain. So getting that checked by a physician and then detoxifying completely is what is very important for any kind of brain health and neural disorders. Sweating, like we spoke about earlier, to clean the pores and aid in detoxification. And if you are a current or past smoker, to make sure that you're either coming off of it and quitting or detoxifying from previous effects. Smoking is the effects for your brain and your lungs are very detrimental. And exercising 30 minutes at least 3 times a week to the point where you are either sweating profusely or getting to the point where you can actually feel your heartbeat raising. That at that point is when you're actually increasing circulation to the level of your brain. And then hydration. So, like we spoke about earlier, water intake is very important for detoxification of all the systems. And be sure to drink at least 70 to 100 ounces, depending on your weight, your lifestyle, and your dosha of water each day, like we spoke about earlier, going into whatever your body weight is, cutting that in half, and that is your very bare minimum. Going more than that is always good and healthy for your body, but just making sure that whatever the symptoms you're presenting with or family members presenting with, you speak to either the consultant or a doctor about it to make sure they can give you the right advice and the right supplements and the right lifestyle changes. And that is a very brief outlook into our nervous system and Ayurveda. If you have any questions, please go ahead.
Yes, thank you, Dr. Isha. Would anyone like to ask the doctor a question?
I have a question. For Parkinson's, is there a number of panchakarmas that are suggested, or does it depend on the individual?
It definitely depends on the individual and the severity of the Parkinson's that presenting with. Traditionally, we start with 21 sessions with something that is nervous system related. We prefer it to be consecutive 21 treatments just because the brain is a hard thing to detoxify. But so that would be your bare minimum, is to be 21. More than that would be depending on the severity of your disease and the symptoms that you're presenting with.
And when you say consecutive, is that once a week?
That would be every day, but of course, in today's day and age, that's almost impossible to do. So a lot of people that we see come twice a week or 3 times a week. Very rarely do we have someone come in for this kind of severe issue once a week, but that's still definitely helpful as long as you're keeping up with your supplements throughout the week, keeping up with your dietary recommendations throughout the week. So making sure that your body is still staying clean and staying in that detoxification balance, as opposed to, you're cleaning one day and then the rest of the 6 days you're undoing what you've done and then going back on the seventh day for a panchkarma. So along with the panchkarma, your ahar and your vihar is very, very important. Your lifestyle and your diet makes up, it's just as important as the pancha.
Thank you.
Would anyone else like to ask the doctor a question? Okay.
I don't have any questions, but we started going to Dr. Kaushik back in 2021, for my husband, and so I knew a lot of this information was already familiar. I guess there was other lectures on this, other topics I might have missed. But these treatments, my husband had like the ozone, the oil massages, and these, I mean, he saved his life. Yes, these are all so beneficial to all aspects. I love this protocol, this treatment plan, and this was very informative because I didn't realize, I got more information about the Parkinson's, the Alzheimer's, and dementia, which it all makes so much sense. So thank you.
Thank you for sharing that. I'm so glad that your husband was able to get that help and hopefully he's feeling a lot better. And I
Oh,
really
yes.
appreciate that.
Yes. Oh, yeah, and we've referred so many other people to Dr. Kaushik. We call him Dr. K, but so many other people have been patients of his and have been healed. Somebody ready for dialysis, they said, no, you can't even do dialysis. We recommended. He was doing every day the treatments,
Mhm.
driving like 2 hours a day. I mean, so this is real and it works. I mean, we have so many testimonies in our family and friends.
Absolutely. And something that he's doing now is trying to get the word of Ayurveda out and trying to spread how efficacious and efficient it is. So the testimonies really matter the world to him. So thank you so
I
much.
just gave his information to someone at a Christmas party Sunday. I even
Oh,
took my
that's wonderful.
granddaughter, she's 15. I brought her there in April and had her hair tested and got a treatment plan for her just to keep her healthy. She wasn't really showing too many symptoms, but I just wanted her to start the process, and it was great.
Yes, big thing about Ayurveda is prevention. That is one thing that Ayurveda and naturopathic medicine is really good at is preventative care. So starting, your granddaughter very young is amazing of you to do.
Yes, yes. Well, we believe so strongly in it. Yes, definitely. So thank you. Just stumbled across this accidentally that there was a lecture tonight. So thank you so much.
Thank you.
Thank you. Anyone else? Okay, well, thank you so much, Dr. Isha.
Thank you.
we-
I just have I'm so sorry, just a very short
Yes.
message from Dr.
Yes.
Kaushik himself.
Yes.
He's presented most of the series and he this is the last presentation of the series and none planned for next year so far, but he just really wanted to thank everyone that has joined him in the past or followed along with him on these series, and he would really like to thank everyone at Pauling Library, especially Dawn, for spreading the message of healing and coming along on the journey and bringing everyone together here, and he's just so very grateful. Thank you.
Thank you so much. Thank you. All right. Thank you, Dr. Isha. Thank you, everyone, for joining us tonight. And I wish everyone healthy and happy holidays.
Thank you. Happy holidays,
Thank
everybody.
you. Happy holidays.
Thank you so much. Bye-bye.
Thank you. Happy holidays.
Bye now.
Bye.